All right, welcome back, everybody. I am Dr. Greg Eckel, and this is my friend to the north, Dr. John Dempster. And our topic today is the gut-brain connection. And what we're going to be doing today, Dr. Dempster is a board certified both in naturopathic medicine and functional medicine, founder of the Dempster Clinic up in Toronto, Canada. He focuses on a functional medicine model to treat patients ranging from high performance individuals to those wanting to treat or prevent chronic illness. Dr. Dempster is the founder of the Healthy Gut Institute, which I'm excited to talk to him about, an in-depth online program designed to help identify and treat the root cause of chronic digestive issues. Welcome aboard, Dr. Dempster.
Thanks, Dr. Greg. Great to be here.
Indeed. So we are talking the gut-brain connection. This is like hot in the news. It's kind of coming out about the microbiome, and the gut is the second brain. And you were talking about you're on a summit coming up. So this is top of your mind as well. Why did you want to talk about this topic today?
Well, I think this is a huge topic, not only for the situation that we're dealing with right now with, I would say, a mental health crisis, but I look at the gut as the gateway and the stepping stone to so many facets of health. And, brain health is such a huge part of what we're going to talk about, but there's many other facets of health that the gut is equally important for in terms of the stepping stone. So I am extremely passionate about gut health and brain health together. I think this is going to be a fascinating topic today.
Love it. So how is the gut impacting our overall health? We're both naturopathic physicians and, we get the picture, but for our listeners of what the health, what is this? How is it fitting into the picture?
So I love the title of your podcast. That's great. But the gut, how does it fit in? So yeah, great question. To me, again, everything comes back to assessing what is going on there. Now, what do we need to be looking for and talking about? The gut is where a huge amount of information is processed and assimilated every second in our body. And for example, just to shed some insights here, we've got ostensibly two brains in our body. We've got our central nervous system, which is largely our brain connected to our spinal cord. And then we have our enteric nervous system, which is a huge part of our digestive tract. Now, the amount of neuronal activity that's in our digestive brain, if you will, is actually very similar in terms of quantity than our spinal cord. So it's a significant amount of neuronal activity that's present in our enteric nervous system. So we've got to give that some credit whenever we're talking about brain health and neurological health and everything else health related. We've got to make sure that we are connecting the enteric nervous system to that. And there's literally a cable, a nerve that connects our two brains called the vagus nerve. And this is a highway of information, and it's sending signals up and down many times over each second that we are alive. And it's so important to make sure that we understand that connectivity.
That's awesome. When you go to see the neurologist in conventional medicine, they're dealing with the central nervous system. And now we've got all of this information coming out with our neurotransmitters also manufactured in our gut, that vagus nerve connection with parasympathetic activity. People are just not getting complete care.
I think it's a good statement to make. I think we could be getting a more comprehensive area of healthcare when we look at the full body and the full person. That's what you and I, as functional medicine experts, when we look at the body, we're not just looking at the affected area, we're looking at the whole system. So I think it's so important that we start to bring in these conversations of integrating both sides of medicine. That's really one of my big passions, Greg, is to make sure that we're not isolating people into camps here. We're heading into 2021 here. This is a big time in our lives right now to see advances in healthcare, and it's time to do this.
Yeah.
Not Eastern medicine versus Western medicine. It's time to bridge the gap, and we really need to have doctors talking about this on both sides so that patients don't feel confused. They don't feel that they have to pick a team and that they can't talk to their other doctor about seeing their naturopathic doctor, or they're abhorred to talk to me about the medications their medical doctor may be prescribing. It's time to come together. It's pro-health.
It is. I call it is the best healthcare that you can get on the planet when you get that East meets West naturally kind of component. So let's talk about that. What is the gut-brain axis and how does that work?
Well, the gut is where we start to facilitate a lot of nutrients. And there is a lot of activity that happens there with what we call neurotransmitters. It's probably not a new term to everyone listening, but neurotransmitters basically are very powerful chemicals that are secreted and go all over our body and have a huge impact in our central nervous system, in our brain. And these are chemicals such as GABA, serotonin, norepinephrine, glutamate, and so on. There's a number of dopamine. And a large amount of these are actually produced in our gut. And this is so interesting when you think about this. If we're treating somebody with anxiety or depression, and we're just focusing on this part of the body, we're missing a huge amount of information that we could be presenting our patients with. For example, serotonin is anywhere between 85 and 92% of the total serotonin is produced in your gut. So if we're talking about depression, which has a huge connection to serotonin levels in our body, we must be talking about the gut.
Got it. And are you able to measure those neurotransmitters at all? Do you do that in your functional clinic?
There are labs that are out there that do that. I would say that we're still in the early stages of that, and it depends on where you are in each province in Canada or in each state in the US. You can't always access the same labs depending on your jurisdiction. For example, in Ontario, we're not permitted to measure neurotransmitters. So we have to look at other means to start to understand what's going on in the body. But there are labs out there, and I'm very familiar with them because we hear a lot about them that are promoting, the effectiveness of measuring neurotransmitters. Truthfully, I still think we're in the early stages.
I agree with you. I had done a run of measuring urine metabolites, and I didn't really see it correlate to the clinical picture. So just as a clinician to clinician, what's the role of the leaky gut here?
Well, leaky gut is a syndrome. It's not a disease. So it's important to distinguish that because this is a very, I would say, almost controversial term when you're speaking Western medicine to other types of medicine. It's a very common term in our arena, Greg, but this may be something that's not quite, I would say, commonplace when you're dealing with an allopathic physician. And that's not to say it doesn't exist. It's just there's different terminologies. For example, intestinal permeability is a medical term that we would commonly use to describe this condition of leaky gut. And you can't diagnose it as a disease, as I mentioned. It's a syndrome. So it means it's the collection of symptoms that we have to use our logic and then start to make some presumptions of what may be going on. So it is something that is, I would say, is very important for us to consider, but it's not necessarily the only thing we should be hanging our hat on. And there are tools and tests and labs that can give you some insights if you may be dealing with something like this. But there's no, in my opinion, one leaky gut test. We have to look at the full picture.
So what are some of the symptoms that you're looking for when you're considering leaky gut?
Well, some of the classics really begin with digestive issues. You can have gas, you can have bloating, diarrhea, constipation, heartburn, reflux. You can have all those classic digestive complaints. But we are seeing a lot of literature right now that's starting to investigate the possible connection to inflammation, and inflammation to whether it's mental health conditions or joint pain or skin issues, or just general health in general. We're seeing inflammatory markers. The higher some of these markers may be, we're starting to see some deleterious activity downstream. So what does that have to do with leaky gut? Well, your gut lining really is the gateway to controlling I would call it the heat of the fire. So measuring the inflammation. So it's like if you go on a camping trip, it's okay to have a campfire within the self-contained pit. But what happens if a spark shoots off into the forest beside your tent and sets that ablaze? Then we have an uncontrolled situation. And so if we have different situations happening in our gut that are allowing molecules to get past that barrier and get into our bloodstream, that's going to set off a different inflammatory event. And quite often it's a multi-pronged event that's going on.
Got it. And so then how does this relate to the brain?
Well, we're seeing some connection between this whole syndrome called leaky gut syndrome versus something called leaky brain syndrome. And there's, again, you can't diagnose by using one special test if somebody has either of these. It's using some common sense, looking at some biomarkers that might give you some insights as to what's going on in the body, because the actual permeability of the blood-brain barrier is very similar to that of the gut lining, which is where we get those cross reactions that can be going on. For example, things that cause leaky gut that can potentially start to irritate the brain lining are different toxins in our body, like heavy metals, such as lead, mercury, arsenic, aluminum, different foodstuffs. So we're hearing a lot about the mental health impact of certain foods, such as gluten, for example. And this is a whole nother conversation, Dr. Greg, that we could probably spend over an hour on just by itself. But in short, it's not that bread is the devil or bread is bad. It's what we've done to it. And unfortunately, a lot of the grain, the gluten-containing grains specifically, have been affected by certain compounds in our environment, such as glyphosate is one of them. And then there's potentially some genetic altering that's happened along the way as well. So we're seeing gluten as it gets picked on a lot, but it's for good reason. And there are many people out there that really love their gluten and they won't ever give it up. But we have to always just say, look, we have to look at this as a neuroendocrine disruptor. And I've been very fortunate to spend some time with some of the top gluten experts in the world down at Harvard. One of them, Dr. Alessio Fasano. And he's just very, very bullish on the impact that gluten can have on the body. That's just one very big area to look at.
Well, that's huge. I actually have a little bit of time for that discussion there, because, we have talked about on the show the gluten component and the inflammation, but I'm curious in the specific mental, emotional realm and what you're seeing there, what correlation is happening with gluten.
I've seen, and I've been in practice for over 14 years, and I've seen a lot of patients come through here with different levels of anxieties and all on that spectrum, and different levels of depression all on that spectrum as well, even autism and schizophrenia and so forth. We've seen that if we can reduce some of the inflammatory burden in the body, starting with the food we eat, and gluten is a very pro-inflammatory food for many of these individuals, we start to see a lessening of the symptoms. And that doesn't mean that gluten fixes all situations of autism or all situations of anxiety or depression or bipolar. But we see it over and over again be a powerful starting point in a conversation that should be having as a cornerstone to somebody's care. We shouldn't just be lunging directly on medications as a first-line approach. Trust me, they are there for a reason, and for some people, they absolutely need those. But for many people, we should be starting by looking at what are the root causes. And the root causes that aggravate an inflammatory response are what we should be starting our conversation with.
You naturopath. That's awesome. That is what folks of What the Health. This is why I brought Dr. Dempster on. We want you to, if you're liking the show, please share us with your friends and family, because, food is your best medicine, and there is a continuum of care. So this is exactly why I wanted to have you on What the Health here. So what are some of the testing that you offer to help gain a deeper understanding of one's biochemistry?
Well, we really leverage a number of labs for each patient. And I always tell my patients, we have a big toolkit in front of us. We're going to handpick the ones that are most likely for you. And even before I see somebody, I put them through a very intense onboarding form. And it can take them 2 to 3 hours to fill this out, so that when they come in, and I've already read this, I already start to see some of the systems that I need to focus on. Much like yourself, we want to gather some data, and we want to be able to take a lot of that guesswork out of things. So when they come in for that first appointment, we're running a number of labs, and they can be a number of things, but the common ones that we see, Greg, are going to be me looking deeper into their gut function right away. And there is no perfect microbiome test available right now, but there are tools that are shedding some insights on areas of the microbiome. And again, for the listeners, the microbiome is just a collection of the microbes that accumulate in your gut. And we have microbiomes all over our body. We have them on our skin. We have them in our nose, in our eyes. But the gut microbiome has the biggest impact on the brain health. And we want to start to assess, do we have some invaders or unwanted house guests that are in there? And this can be done in a stool sample. And there's a number of labs that offer this, but there's some that are out there that are looking at different areas. We're also measuring to see if there's some inflammation going on in the gut lining, and any sense of the fact that there might be some of this intestinal permeability going on. There is no perfect leaky gut test out there, as I alluded to, but there are markers that we can look at. And again, these are markers such as calprotectin or zonulin, and then looking at bacteria, yeast, fungi, parasites, even viruses. You can start to get a sense of what's going on in the gut. And so we will start to often look at assessing that stool. We will also measure their nutrient levels. And this is very important because our nutrients in a standard blood test can kind of go up and down pretty quickly. Often within 24 to 48 hours, you can get a different read. But there are other labs out there that can give us some deeper insights as to what's really going on inside the cells. And those nutrients are critical for brain health and for optimizing a lot of factors in our body. And again, depending on that patient's background, if they've been exposed to toxins that they feel, or they have a mouthful of mercury, we're going to start talking about the impact of different toxins in their body as well. and then understanding, okay, if we identify these things, what can we do about removing them?
Mm. So those are two big areas. Are you doing like PCR stool samples or more micro assessments, or both, or depends on the patient?
It really depends, but yes, we have patients that can do those at all the above, really.
Got it. And do you have a preference on any of those, or found
So
any trends for folks?
yeah, I mean, there's two labs that we utilize a lot. We utilize a lot of doctors' data, and we also utilize a lot of the GI map, which is Diagnostic Solutions, which is a little bit more of the PCR side of things. And so those two labs have given some very strong, powerful insights.
Got it. Yeah, we use here the GI maps and Diagnostic, occasionally Genova,
Correct.
occasionally doctor's data, kind of flip it around. Over
Exactly.
20 years, you kind of change it up a little bit.
Well, that's the thing, because not one test is going to tell you everything.
Right.
And so we want to be judicious in the sense of what test can we actually use that's going to provide value to our patients without cutting too many corners. But at the same time, we don't want to be testing right, left, and center either. At our clinic, we're really focused on the data. So testing is part of our patient experience.
Awesome.
We want to make sure it's appropriate to each patient, which is why we don't have a one-size-fits-all program. We handpick these for each patient.
That's great. So you're individualizing the treatment. Sounds very naturopathic, integrative medicine approach there, Dr. Dempster. Thanks for that. We do appreciate it, because I think both of us see in the field a lot of folks that, order the test. It's like the test don't guess scenario, but then they're treating the test and they kind of lose sight of the individual in front of them. And so to hear, you're individualizing it depending on what the needs are, taking that clinical case, and gathering the information that way. That's awesome that you kind of pinpoint it. Are there any other spheres that you've seen in assessing that gut-brain axis? Or let's talk around the anxiety component and depression, because that seems to be really rampant. I know in my clinic, just with the pandemic, patients are it's getting old. And so there's patients, like I'm talking to business owners, and they're having to force mandatory lunch periods. And they're even talking about turning their servers off after a certain hour so that employees have to take a break, because people are just kind of burying themselves in work. I don't know if you're seeing that up in your area as well.
Most definitely. This pandemic doesn't have borders, and we're seeing, in Toronto, we're a large city, and we're very very driven city. There's a lot of very A-type individuals here that have very big jobs and are working tails off. So, this is something that it didn't happen just because of the pandemic, but I think the pandemic has been this pressure cooker that's starting to show cracks in the manifold, right? And I think if we had to take any positives away from this, it's about, as you said, let's go back to assessing our workplace environment, making sure that we're being cared for properly. If patients or clients of yours are getting these mandatory lunch breaks, that's great. In the past, sometimes we would work all the way through without taking lunch. We've got to take in all of these areas right now that impact health. But some of the things you made me think of earlier there's a couple other things that are really important when we're addressing this situation of brain health, anxiety, depression. We have to talk about food, of course. Food, beyond gluten, we can have different types of intolerances and different types of reactions to food. Again, not an uncommon conversation for a fellow ND. But it's not about always just eliminating things, right? I think one of the things that we can fall into a trap very easily is getting our patients on the air and water diet. You know what I mean? It's just that diet, that food list is just getting whittled down. We've got to be very careful about that. We've got to make sure that we're providing areas of foods that we can eat. And so that was, excuse me, so it's not just such a restriction being placed on everybody all the time, especially with this pandemic. I think we're all feeling restricted consciously and subconsciously. So that impacts a huge other area that we haven't touched on, which is your adrenal status and your hormones. Measuring cortisol. We've never seen or identified, whether we're aware of this or not, our body has not been able to process this type of pandemic in our lives anyways.
Right.
And so we've got all sorts of things going on in the background and in the foreground that are affecting stress levels in our body. And we've got to take that into consideration.
Got it. And part of your assessment and kind of onboarding of new patients, you're doing functional analysis of their hormones as well?
We are, definitely. And again, handpicking for the right panel for the right patient, but we're certainly looking at that as a massive area. If somebody's trapped in that fight or flight state, it's going to be very hard for them to recover and get some forward momentum when all they're trying to do is just keep their head above water.
Sure.
So we have to start to look and identify where those stressors may be. If their, let's call it, their adrenal panel is lit up, we want to make sure that we're starting to pick apart that and looking at things that we can tangibly change so that their body has a chance to heal.
Nice. Yeah. So do you have any tips or off the cuff remarks around that? Because it is such a big thing. Folks are stuck in sympathetic overdrive with kind of chronic barrage of negative news and, kind of uncertainty in their world. Do you have anything that you like, kind of the broken record, Dr. John up there of like, you're telling everybody like, hey, do this?
I've got a couple broken records I'll share with you.
Yeah.
Number one, turn off the news.
Yes.
Right? We know what's going on. We don't need to be drilled in every minute of every hour, what the numbers are doing, what's going on. We're aware of what's going on. As long as you have a general sense of what's going on, shut the news off.
Yes.
That is 99% negativity that we do not need to be hammering into our psyche on a daily basis. And so that's an important one. It's not a matter of being ignorant, by the way. It's just, we get it, right? We get it. Let's move on. Number two, I share this with every new patient that walks in my door. I'm going to teach you how to reduce the impact of stress by 40%. And it doesn't cost a penny. You can take it with you anywhere. And no matter how busy you are, you can still do it.
Awesome.
And I learned this again down through some researchers at Harvard, that if you do 10 consecutive deep breaths, and you do that regularly throughout the day, and they say hourly, you do that regularly throughout your waking day, you're going to reduce the impact of stress by 40%. And this is huge for my busy patients, and everyone's busy. So we want to make sure that we're making this doable for people.
Awesome. That's a great tip. So 10 deep belly breaths every hour. And it's a 30% or 40% reduction that they've shown.
Up to 40% reduction in the impact of stressors that we're facing with every day.
Love it. Wow. So you add that with a walk in nature, and that's a 25% reduction of cortisol. So you got like a 65% reduction of stress impact. That's
and
awesome.
Then you throw in a side order of Dr. Eccles acupuncture treatments, and you're right up to 90%, right?
And we got you into healing. That's how it happens right there, folks. So there it is. We got it solved, Dr. John. That's awesome. If it was that easy. So what other nuances are you seeing with this kind of the gut-brain axis? Where are the pitfalls for folks? What are some of the hurdles that folks have to overcome when they kind of start into a program?
Well, I think we're in the information generation, which is a great thing. Podcasts, summits, all of these things are accessible to people online, even just reading an article. So a lot of people are becoming advocates for their health, which I think is a tremendous step. But a lot of people are just self-prescribing at the same time. So, when we self-prescribe, sometimes we may not be doing the right thing at the right time for the right person. So one of the biggest pitfalls I see are people when they start taking probiotics, and probiotics are very powerful. They're very important. They're a massive connection. In fact, we can talk about a whole area of probiotics called Psychobiotics if you'd like. But probiotics actually form a tremendous stepping stone in that gut that we've alluded to earlier, that's necessary for B vitamin production, for nutrient absorption on all the other realms, and starting to stabilize some of the other activity that goes on in our brain. The problem with some probiotics, not with all, is that there's just not a lot going on in there at the time of that we pop them into our mouth. These are, generally speaking, living things, and they have a rate of attrition. And so if you're not buying a good quality probiotic, and the consumer is not aware of what's good quality and what's not, sometimes it's just a waste. And then we find, patients like, well, I tried a probiotic, it didn't work. Yeah. Well, what was the dose? Oh, it was 1 billion. Well, okay, that's interesting. Because, starting doses that we do with our patients are anywhere between 80 to 150 billion, upwards of 1 trillion, depending on what that person needs. So sometimes if we show up with a water gun to a house fire, we're going to have a harder time putting that fire out.
Got it. And what are you seeing with kind of the probiotic strains specific for brain health?
So there's 2 big strains that, again, are lumped into this psychobiotic umbrella. That's sort of this new term that is a catch-all for any bacteria, healthy bacteria, that can impact anxiety, depression, and mental health and brain health. And so different types of psychobiotics that are in the big umbrellas are in the lactobacillus family and the bifidobacterium family. Now, those are very common ones that we see in a lot of the probiotics, but there's some specific strains within that. So, for example, lactobacillus rhamnosus is a very good, what we call psychobiotic for anxiety and depression. Same with Bifidobacterium brevi and L. plantarum. These are ones to be looking for when you're starting to do some shopping and some investigations for your probiotics. But the other thing I will say, and again, I'm just reiterating this, not all probiotics are produced the same. And if they are produced inferiorly, they are going to die off. And what's on that label is not going to be in that capsule at the time of consumption. So you've got to be very careful about working with brands and products that are going to ensure that at the time of expiry, this is what's guaranteed to be in there.
Yeah, that is a big point. Bastyr many years ago, maybe a decade ago, did a study. They pulled 10 products off the shelf, and only one of those had actually any live bacteria that they could culture back. So it is, a buyer beware. I think, we're as professionals doing due diligence for our patients around, making sure we've got the third-party assays and that we can really know what's going into them. I mean, it is a medicine, right? So we want to treat it that way. And that's one of the big things that, oftentimes I'll get patients say, well, can't I just get it down at like the health food store or Trader Joe's, kind of a convenience store? It's like, you could. And, I know that these work. These are the ones that I've seen. They're time tested. We get results with them. So it is a buyer beware component out there. When you were talking about the nutrients and specifically brain nutrients when you're doing the testing, is there any general trend or theme that you're seeing for your patient population?
I see a lot of B vitamin deficiencies, and just to clarify, there's more than just B12 and B complex out there. There's up to 9 different B vitamins. So we're measuring the full spectrum, and we'll see a lot of B2, we'll see a lot of B12, a lot of B5 that's deficient, and those have big implications on many systems in our body, including brain health. I see a lot of deficiencies in omega-3s. Omega-3s can come from plant-based sources. They can also come from animal sources, largely fish and seafood. And omega-3s are just that good fat that our brain needs. We could be called fatheads.
I love that. Yes, affectionately.
Yeah, exactly. And so sincerely, that brain of ours requires beautiful fats, beautiful healthy fats. And omega-3s are one part of that. And I see that coming back low in a lot. I also see a lot of the fat soluble vitamins. So speaking of which, coming back to the gut for a moment, we've got this thing called the gallbladder and the liver, right? And the liver produces bile, which is stored in the gallbladder, and that's necessary to digest a fatty meal. Well, how many people do you know and see in your practice that have problems with their gallbladder? And we see a lot. I don't know about you.
Tons.
And so I've had a lot of patients that come in and are like, oh yeah, my doctor just took it out one day thinking that I was going to have a problem down the road. So he thought he was
preventative. Yes.
So what happens is when we have a deficiency in whether it's bile storage or bile secretion or bile flow, whatever that may be, we're having problems emulsifying these fatty foods to extract vitamins A, D, E, K, etc. And those are brain fuel foods as well. And we want to make sure that and I see a lot of deficiencies in those, for example. So to answer your question, B vitamins, omega-3s, fat soluble vitamins over and over again. And I also see a lot of glutathione deficiency. Glutathione is one of my favorite nutrients for brain health, for immune health, for reducing inflammation and removing toxins from the body. So if we have a deficiency in glutathione, there's a tremendous amount of systems that are suddenly impacted.
So what do you see for a gallbladder deficiency? Are there some symptoms that you're looking for, or some signs that patients are telling you?
Well, I think it comes back to the digestive system, and we see a lot of gut issues come in here. And if we see somebody that has, they really feel awful after having a fatty meal, that's a dead giveaway. Some people, it might even be green stool, which is usually a pretty serious situation that we've got to get on top of right away. But if there's ever abdominal pain that's in the quadrant of where your gallbladder generally resides, it sits just below your liver. So keep an eye in that liver area. You've got to pay attention to what's going on and test it with those fatty meals. It's a good way to really put some strain on an inflamed gallbladder.
Love it. Yeah. So there you go. Go out and get that Alfredo sauce.
Maybe we want to quantify it. It doesn't always have to be the real gnarly fatty foods, but it could be a shot of olive oil too, for example.
There you go. Yeah. A question on your omega-3 omegas recommendation, or just seeing that's a piece of the puzzle. What do you think about vegetarians with flaxseed, chia seeds, and those omegas? Are they usable?
Well, the answer is yes, but poorly. In fact, there's three significant types of omega-3s. We have our EPA and our DHA up top, and then we have our ALA down here. Now, the ALA is largely sourced from plant-based sources, your flax, your chia, your hemp. And it's not to say that you can't convert that to your EPAs and your DHAs, which have a huge role to play on brain health and inflammation control in the body. But it's a very poor conversion rate. It's about a 2% conversion rate. So you've got to have a heck of a lot of non-oxidized flax seeds to get that equivalent of having, a shot of very clean fish oil. The concerns are, well, fish, in the ocean, they're contaminated with mercury and who knows what else. But there are all sorts of labs right now that are testing very small fish sources of these omega-3s that come back perfectly clean. Herring, sardines, anchovies, these tend to be really good sources. The new kid on the block in the last decade has been krill oil. There's other ways of looking at sourcing these that are not only safe for you, but also viable for the oceans and viable for our ecology.
Yeah, great. Thank you for that. Well, let's see. So we're coming up to the last bit of the show. I'm wondering, I wanted to talk about your Healthy Gut Institute. You've got an online program.
Yeah, we were seeing a lot of people that were coming in from all over the world to get some advice and to work with me one-on-one, but that's more now than ever harder to do. Yeah. And so I decided, let's try and get some information out to people that they can do it yourself from home. That's going to give them the step-off points, just some fundamentals, and this is a very in-depth program. I've had the fortunate experience working with and meeting with Dr. Josh Axe for many times over, and I remember the one time he gave me his blessing. He kind of said, okay, this is a good course. You can get that out there to the world. But, this is somebody who's obviously been a big founder in the gut space from the course production side of things. I think now more than ever, we should be looking into online sources to help us just get some staples underway and from vetted sources. So that was really the passion that drove that, and just to help people get some real good momentum that they can do on their own. Nothing replaces working one-on-one with a doctor, but not everybody can do that. And you and I both know not everybody can afford that. So we tried to bundle this in just to give them as much info in a very easy to access way. And it's been very helpful for many.
Love it. So that's a great way to deliver kind of foundational information and get people started on their path back to Wellville is the way I talk about that. So so if somebody, I'm going to put the links to that in the show notes for folks that are watching and listening. What can somebody anticipate? Like what does that look like? I'm just curious how you deliver good content on your course to folks online.
So it's based on what I call my HEAL methodology, HEAL. And so it's bringing in, heal and seal, eliminate, add, and lifestyle. And so those are the main modules, but I also have what's called a quick start module, which kind of gets people up and running right away. And we also have a bonus module with a number of different interviews with world experts, such as Dr. Axe and a number of others on there, Dr. David Jockers and Jordan Rubin and so forth. And so we're just trying to chock full of value just to present this to people so that they can start to see where some of those common pitfalls are and start to apply those.
Love it. Oh, that's so exciting. I'm excited to check that out. Do you have any final parting words to the listeners of What the Health?
I think something that I've noticed after listening to numerous podcasts is you walk away and you've got all this information. And you're like, oh my gosh, I can't possibly implement all this at once. That's what I want to really stress here. It's not about perfection. It's not about doing all of this at once. It's about making progress. Do something better today than you did yesterday and continue to do that. And you will start to see this critical mass come together for you that gives you a healing environment. So don't stress for 1 second if you had a grilled cheese and has that destroyed your entire week. No, it hasn't. You may feel like it has, but it's not going to destroy all the progress you've made. Pick yourself back up. Don't try to be this 100% perfect all the time. You're going to set yourself up for failure. Be realistic and really just go out there and stick with this 90% of the time and enjoy life.
Awesome. Enjoy life. Thank you for those sage advice. Thank you, Dr. John. Everybody, this is What the Health. We are here Tuesdays from 2 to 3 p.m. Pacific Standard Time. Please share us. If you like the show, give us some great reviews out there. That's how we get the word out. We're basically a groundswell movement. We want you and your family and your community to raise your vibe and get healthier. Thanks for tuning in.